Local health systems that supply preventive and curative health services are a key aspect of global health. They need to be effective, equitable, efficient, and sustainable. And successful health interventions need the four S's: systems, staff, space, and stuff. All of those require money. Global health financing is complicated because of the wide variety of organizations involved, from governments to worldwide WHO programs to small charity-driven NGOs, as we previously learned. Meanwhile, local governments and local healthcare providers are the key players in effective health systems, and they face a number of challenges in areas where resources are scarce and where demand is high. One specific problem that they face is what is often called brain drain of health staff that are trained in poorer countries that then migrate to richer ones. We see this globally. Have you noticed, for example, how many medical professionals you encounter in the United States who were not themselves trained here? As well as regionally, with shifts, for example, of doctors from low-income nations practicing in lower middle-income nations in the same region of the world, and doctors trained in lower middle-income nations traveling then to work in upper middle-income nations in that same region of the world. We also see a version of this in the United States, which leaves our rural healthcare systems underserved, and then is responded to in part by recruiting doctors from abroad, and then also by trying to reallocate healthcare workers within the United States who are born and trained here to those areas, with several medical schools and programs offering tuition assistance for providers who are willing to commit to practicing in an underserved rural area after graduation. This challenge is not the fault of providers who work to establish themselves in a setting that they would feel would be best for themselves and their families. Rather, it is a reflection of broader systemic inequities and highlights the needs to both strengthen health systems and living conditions in areas that are currently under-resourced. And I'll call myself out on this as well. So I grew up in a rural area, and while I am not myself a healthcare provider, I do have significant formal training in public health. But rather than working in health promotion in the small, rural, deep southern town that I came from, I've instead carved out the life that I want for myself and my family here in Boston. And so it's understandable that people would want to build the life that they want and the career that they want. And it really calls for the need to better address on a policy level ways to combat brain drain so that different countries and different areas of the world are not deprived of the healthcare professionals that they need. We've also addressed community health workers several times during this semester, addressing how impactful their work can be, but also that they are vastly underpaid and at times put at risk in their employment. These and other local health workers are parts of a larger health system, and many of these larger health systems around the world are funded in part by international aid. While there are very real problems with international aid for health and development, as we've addressed over the last several weeks, this aid still helps save lives and improve the quality of life for many people in lower resource settings. It's also important to remember that no health system exists in isolation, and that understanding the treatment choices that people have in this pluralized and multicultural world is important. Traditional medical systems, which are also called ethnomedical systems, have meaning to the people who practice them and are not always at odds with the goals of public health, despite what outsiders may think. This isn't to say that the global health community needs to embrace solutions that are not evidence-based. As we know, global health is founded on evidence, and evidence-based solutions are critical to public health efforts. But rather, that it's necessary for biomedical health systems to understand and sometimes accommodate and cooperate with local medical practitioners, rather than simply dismissing them out of hand. The WHO conceptualizes health systems as made up of 6 building blocks. Health systems are complex, and these building blocks, therefore, are simplifications, but they can be a useful way of thinking about the kinds of resources that a health system needs. Without these building blocks in place, there can be delivery bottlenecks that keep the entire system from functioning. For example, a state-of-the-art diagnostic lab for tuberculosis is of little use if there are no trained staff to run it, or if there are no treatments available. The building blocks are leadership and governance, because good management is a critical part of an effective health system. Healthcare financing, because all of those building blocks cost money. The health workforce, because we need workers, and health workforce shortages are a major problem in many health systems around the world, as we'll discuss further. Medical products and technologies. Not only do products like drugs, vaccines, and test kits have to be purchased, they have to be delivered to the people who need them. This is very important and very complicated. Stockouts of essential drugs are common in many health systems without enough funding. Thus, ample supplies and logisticians to help keep those supplies flowing where they need to go are keys to a well-functioning health system. As just one example, health systems need what is called a cold chain that keeps heat-sensitive drugs and vaccines cold all the way from their point of manufacture to the people who need them, including people who may live in areas without reliable electricity. A functioning cold chain, then, may need to include fridges, freezers, refrigerated transport, generators, fuel for the generators, and more. Information and research. Understanding what is going on is a key part of solving problems. This building block includes disease surveillance, which we've all been learning about more in the response to COVID-19 and tracking it around the globe. And sixth, service delivery. This is the most obvious and visible part of a health system, the actual provision of health services to the people who need it.